This is Clinical Pilates Quick Tips. I'm Mary Thornton, Physiotherapist, and today I'm going to be looking at hip openers. Now, often people get quite jammed up in their hips when their bodies have been compressed for long periods of time. So today we're just going to look at how to release this in a very subtle, gentle way, not to cause too much pressure. So often people go into doing kind of big ranges of movement initially after long periods of rest or movement dysfunction. But it's really important to keep it small and mindful right at the beginning. So we're going to lie down. I'm going to use a few props. So we're going to use some pillows to begin with. So if you're new to it, I would recommend you using a low pillow. So just like a little scatter cushion, something that you find around the house. If you've been doing this a while or you need to progress, you work into a higher pillow. So this is kind of a soft bolster. So let's just have a look first of all with the lower pillow. So you probably need something under your head initially, just to give you extra support, because the more the body's supported, the more it's going to give to you. So I'm going to lie myself down. I'm going to place the pillow underneath the pelvis. And thinking of bringing the knee in towards the chest. So you just bring it into where it feels comfortable for you. So maybe hold behind the thigh and draw the knee towards the chest. If you have any pinching in the hip or groin, sometimes it feels more comfortable to angle the knee towards the armpit. Both are valid, it really just depends on what feels comfortable for your hip joint. So just taking the knee slightly over and just start to take some breaths. So breathing in and out. Now as you breathe into this, the hip will start to release deeper in towards the chest. Making sure that your pelvis is still heavy on the pillow underneath you. Don't allow the tailbone to lift up. Just keep it down and grounded and the other foot relaxed. So you take a few breaths and then place the foot back onto the mat and then do the same on the other side. So bring the knee in towards the chest or into the armpit, whatever feels best, and take a few breaths. So feel that you're releasing in the opposite hip as well. So as you breathe, just also think of releasing into this side as well as the side that's hugged into the chest. Breathing in and breathing out and releasing. And then releasing down. So even though it might feel that you're not really doing a huge amount here, you are. You know, you're just starting to let it release. There's a real sense of broadening in the buttocks and breathing in. So we're just swapping over again and just breathing into each side. Placing the foot back down and doing the other side. So just sort of 2 or 3 breaths on each side is normally sufficient to start with. Just getting you used to that movement. Because you haven't moved like this for a long time, this can feel quite strenuous. Lovely. So just to show you a little progression from that to take it up higher, if that's what suits you, we can use a bigger pillow underneath the pelvis. And the other thing to do is always lie down first and then put the pillow under the bottom. Don't lie down on the pillow because that will make you arch your back in probably in more of an aggravatory way. So always lie down first, lift the pelvis, and then put the pillow underneath your pelvis. Draw the knee towards the chest and hug in. So just giving you that extra lift. And if you wish to, maybe take the opposite leg out onto the mat and stretch it away. And if the hips are tight, what you often feel is like a clonking sensation in the legs that's straightening initially as that hip tries to release back into its neutral position. And you can increase this by pushing the heel away on the straight leg. But if you're hypermobile, just be careful not to overextend and press the knee into the floor. So making sure that your knee is subtly bent. And to engage that even more, you might want to engage your buttock. So on the straight leg, tightening the buttock, which opens the hip joint a little bit more, but making sure that you don't snap back the knee and hyperextend. And always when you've finished, you might want to finish on the side that needs it most. Just do some knee sways just to release the pelvis out before you come out of the position. So that was hip openers. just focusing on releasing, just looking at those real basic stages for people who are just getting back into movement or after rehab, post-op, anything that creates tension in the body, just bringing it back to a normal pattern of movement again. So I hope that's helped. If you liked it, press like or subscribe to the channel, or let me know what else you'd like to see, and I'll make a video for you soon. Thanks for watching.